Tuberculosis, or TB, is an infectious disease. It is caused by a bacteria called Mycobacterium tuberculosis. TB is transmitted from one person to the other through tiny droplets in the air, produced when a person with TB coughs. TB is a disease that mainly affects the lungs. The main symptoms of TB are chronic cough, that's a cough that has been lasting for more than 2 weeks, or chronic fever, again, that has been lasting for more than 2 weeks, and/or an important loss of weight. TB is a serious health issue worldwide. Each year, it affects about 1.2 million children. And among these, around 1 out of 5, so 250,000 children die. Children mainly die from TB because they have not been diagnosed for the disease in time, and so they were not treated for TB. When a child is diagnosed and treated for TB, most recover in a few weeks. The diagnosis of TB in children can be quite complex for healthcare workers that are located in limited resource settings for many reasons. Unlike adults, in which TB can be detected using microscopy or molecular tests on respiratory samples, such as sputum that is expectorated when a person with TB coughs, collecting respiratory samples is complex from young children. They often don't know how to expectorate on command. And children get sick from TB with very few bacteria in their body. And microscopy or molecular tests are not sensitive enough to detect small quantities of TB bacteria. Due to weaknesses in such tests, clinicians have to diagnose the disease on symptoms that are challenging to recognize, as they often resemble the symptoms of other childhood illnesses. This is especially true in children who are infected with HIV, or in children that suffer from moderate or severe malnutrition. Chest radiography can be helpful to diagnose TB in children, but it is also difficult to read, notably in young children. It thus requires a lot of experience to clinically diagnose TB. To improve TB diagnosis in children, new tools and methods are needed, especially for the most vulnerable children, those below 2 years, those with HIV, or those with malnutrition. A recent diagnostic tool is called Treatment Decision Algorithms, or TDAs. TDAs help to manage complex health data related to TB.
When a child is presumptive for TB, he undergoes complementary clinical examination and bacteriological tests. TDAs recommend to treat when a child has an history of contact with TB case or when he has a positive result to a bacteriological test. TDAs also attribute score to specific clinical data and radiographic data.
And then they compute scores that informs on whether a child needs to start TB treatment or not. TDAs could support healthcare workers in making clinical diagnoses for TB in children. TDAs have been recommended by the World Health Organization, or WHO, for TB diagnosis in children, but the recommendation needs to be strengthened with more data in what is called an external validation.